Folks, Fernando doing another video for Modern Survivalists. Stick around for this video. I'm going to be explaining how to care for someone with coronavirus. The proper protocol, the procedure you should be following. This isn't something I came up with myself. This is straight out of our conversation with David Jones, who's an expert in this field, nuclear, biological, and chemical warfare for the U.S. military over 20 years, explaining and teaching this around the world, Iraq, Middle East. He's been doing this his entire life, and this is what he explained to me. This is something that should be, to be completely honest, it should be on TV, mainstream media. Why it's not? Probably because it's not good for ratings and such. It's kind of a drag. It's going to be a bit of a few minutes going through some steps that you have to follow to the word, and maybe people haven't got that type of attention span. This is the Modern Survivalist channel, so I expect you to have such a focus. So let's get to it. Number one, first point, understanding what you're dealing with and understanding the disease. Most of you already know, but there's still people out there that think, oh, this is just like a regular flu. No, it's not. It's almost, according to World Health Organization, a 3.4 mortality rate. That's over 30 times more lethal than your seasonal flu. No joke. Even if you don't die, you may end up with a compromised, a very delicate respiratory system for the rest of your natural life. All right, and of course, the fatality and mortality rate goes up the older you are. And if you have any pre-existing medical conditions, that also reduces your chances of making it. But the good news is that over 80% of people, you're going to be dealing with this just fine. Maybe asymptomatic, maybe just a little bit of flu, a little bit of cough. That is it. So the steps that you're going to be following are likely to help. Number one would be that, understanding what's going on. And there you will have certain symptoms. If you're coughing, if you're sneezing, if you have a fever, and you suspect someone has a coronavirus, number two would be the first step you actually take, which is isolation. Number two, putting that person in isolation within your household. Ideally, a room and suite with a bathroom so that person can stay there, not leave. He's going to be resting in bed, watching TV all day long, something kind of boring. But that person needs to be isolated and cannot go around the house all day long. Number three is someone will have to care for this person. Ideally, this person will treat for himself as much as possible, as much as physically possible if he's fit and up to it. But there has to be one designated person to care for this now patient, and this caregiver has to be ideally someone that is younger, in good health, fit. That would be the best the best candidate for it. But you cannot rotate, okay, now it's my turn, tomorrow it's going to be yours. No, it has to be always one person caring, so as to minimize caring for the patient, so as to minimize the exposure and the risk of spreading the disease. Number four would be the kind of treatment you're going to be providing for this patient. It's going to be pretty basic. Lots of fluid, lots of rest, some medication for a fever. That is it. There's really no vaccine for coronavirus. Some antivirals may help or not, but basically it's about staying hydrated, resting, and some Advil, some ibuprofen, something for the fever. With a little bit of luck, the person is going to be getting better. Number five is the person that's going to be caring for this patient needs to take lots of precautions in terms of his own personal protection material. The personal protection protocols are quite extensive. There's entire manuals written on this stuff. There's people that spend their entire lives teaching others how to follow these protocols. Goes beyond what I can cover in this video, but you kind of figure out some of this. It's going to be about protecting yourself as much as you can. You're going to be using the respirator. You're going to be covering your eyes. If you don't have safety goggles, you can use a swimming goggle, something that covers your eyes and seals as best as you can. A respirator face mask or a full face mask would be ideal. You want to cover yourself with a hazmat suit. You don't have that one. David Jones explained quite clearly. You can use a raincoat, some rain gear, something that has a hood that covers yourself. You zip it up as much as all the way, and you use latex gloves for your hands. That is how you're protected. You go into that room, you care for this person, you take the food, whatever garbage has to be disposed of, whatever it is, and once you leave that room, you take this equipment off, and you start by disinfecting that which is not disposable. You're going to be using either some bleach with water. Ideally, we'll have some of this stuff. A lot of this stuff I've explained in videos over the years in some of my books. Guys, when we talk about personal hygiene stuff, sanitation equipment and supplies, that's what it is. You know, when this is, by the way, the book I keep recommending, Street Survival Skills, my latest book. It applies to this case as well. It covers most of the basics of survival and preparedness. But if you bought this book and you read it, when it says sanitation supplies, when it says personal hygiene items, when it says N95 respirators or surgical masks, this is the kind of equipment that applies to this type of situation. You need the stuff so as to do this stuff that I'm talking about right now. If you don't have it, maybe there's still a chance that you can just go out there and still buy it. But this is what you need so as to do this, so as to follow this protocol. So, getting back to it, you're going to be disinfecting that which you're not going to be disposing of. If you have a gas mask, you'll disinfect it, you know, and disinfectant like this, you know, it is specifically listed as for flu, influenza, H1N1. So, this is going to be good for this case too, for coronavirus. The material that you are going to be disposing of, you take it off, minimizing the contact as much as you can. So those latex gloves, you take it off, you put it in a bag, your mask, you don't touch it, you just take it off, you dispose of it, and then you take off the rest of it. That is how you're supposed to do it every single time you go into that room. It sounds like a drag, it is, but that's the way you should be doing it. Number 6. How does this continue? Well, this patient, hopefully he's going to be getting better. Once he's not showing any more fever, you control the fever. He hasn't got any fever. He's not coughing. He's not. He looks fine. You give it 2 weeks. 2 weeks of quarantine so as to know that he's fully recuperated and he's not sick anymore. You can safely assume after 2 weeks, based on everything we've seen so far, 2 weeks means there's a good chance he's already recovered. Number 7, don't forget this last step, is disinfecting that room. Using all the personal protection equipment that we mentioned before, you need to clean that room with water, bleach, disinfecting every single surface, disposing anything that was in contact with this person that can be disposed of, and if not, cleaning everything, disinfecting everything, opening windows, ventilating everything as much as possible so as to make sure you've gotten rid of the disease. Guys, that's it. That's the proper protocol so as to care for a person that has been infected with coronavirus. Hope you enjoyed this little video and that you don't have to use it, but if you do, this is the way you do it right. See you on our next video. Have an awesome day.